A warm welcome to you from Geneva, Switzerland. Warm welcome to Placide Mbungi from DRC, who says nice to be here. Akongwi Stephen is one of our guests of honor from Cameroon. Herman Kumbongo from the DRC. Abdulrahman Bello from Nigeria. Gladys Bena Osua, you haven't told us where you're connecting from. Pour Herman Kabongo, cherchez, il y a un interprète pour partager les deux langues. Who's asking why this isn't in French? We do have interpretation, so don't panic. Ne paniquez pas si vous entendez une langue que vous ne connaissez pas. A treasure, Obiajulu, tell us where you're from, but also tell us what you do. Roland Moussa from Taraba State, Dr. Bamba Dominique from the Malaria National Control Program.
We warmly welcome and thank and honor our distinguished national and international partners. But during this event, we are going to be placing the spotlight on those that are at the heart of our mission. They are the health workers that serve local communities.
Thank you, Charlotte. And we also want to acknowledge those who are unable to attend. I picked out two of the messages we receive. Here is why some health workers who wished to attend, here are two examples of why they're not in our Zoom studio today. Charlotte, the first message, if you could read it in French, is from Dominique Kwetekin.
Bonjour, Madame Charlotte. Merci beaucoup pour le mail. Je suis en brousse en mission de service du côté Kapondo, dans la province du Haut-Katanga. La connexion pose des problèmes, même pour me connecter sur Zoom. Je suis obligée de suivre la rediffusion sur YouTube une fois je suis là où il y a la connexion. Merci beaucoup.
And Akabati Fernando wrote to Charlotte as well and said, I'm pleased to read from you. It's always a humbling experience when my little contributions are appreciated and make impact. I'm always willing to join these meetings, but I'm in a rural enclave district with network challenges. I'm counting on paid satellite internet. Point against tomorrow. We'll see. I hope you made it, Fernando Akabati. If the network does not fail, I will be present. So we want to salute and honor those of you who will be watching the recording wherever you may be, whatever may be preventing you today from attending. We are with you.
The good news is that Dr. Akabati Fernando is here.
Okay, wonderful, wonderful, and I'm glad you made it. Now, we'd like to kick off this special event. Before we introduce our partner, RBM Partnership to End Malaria, to really turn to the health professionals who've joined the event. Many of you are our guests of honor because you shared ahead of the event, you shared your experience. We have a very simple question for you. What would you like to know? This is a peer learning event, so what would you like to know from your fellow colleagues about malaria? And we're going to turn to Naoume Abou Ibrahim.
Hello, everyone. My name is Naoume Abou Ibrahim. I'm a National Director of a society that works at community level in the field of health and development of projects for institutions. The last 2 decades of community development in Niger and in the West African region have allowed me to collect a lot of experience, and we have a lot of issues, especially in case of flooding. We have a key issue with access to communities. So it's really difficult to access the villages and help people that are affected by malaria. I come from Niger. Niger is a place where malaria is endemic. So malaria is widespread in the communities, and this causes a lot of issues in terms of health conditions, especially among women, pregnant women and children. And we have a lot of difficulties in case of flooding. This causes a lot of issues. So my question would be the following. In case we have issues in health centers where we do not have access. Health assistance is free of charge for young children under the age of 5 and pregnant women, but in case of flooding, we really have difficulty at reaching the communities. So what can we do? That would be my question. So the community health center doesn't have the necessary resources to take care of these cases. So especially in case of pregnant women, sometimes it's even difficult for the ambulance to achieve the place where people are. The health center is not equipped to take this into account. So in such difficult situations, what can colleagues recommend? What can we do? So how can we really guarantee access and reduce?
Thank you, Naume Abou Ibrahim. We're now going to Victor Garpuli. Victor, a warm welcome to you. Please do introduce yourself. You're amongst our guests of honor. What question, after you've introduced yourself, tell us what is one question that you would like to ask to fellow health workers about malaria?
Okay, thank you so much. I'm Victor Gapuli from Liberia, West Africa. It's a pleasure and opportunity to be invited by Teacher Rich family. As a civil society organization, we have been engaging, working, networking, collaborating with the health worker in our country to make sure that we prevent malaria, that is the cause of the leading death in our country. And we have been very concerned about how much malaria have been treating our people, especially the women, children, pregnant women and children that live in the rural community that do not have access to market rural, access to rural, and have serious negative impact on their life because before leaving the various villages to come to the main rural have been very, very difficult. And some of them end up dying before reaching to the various clinic. Those clinics are not really, really equipped, sophisticated to be able to seize life in that direction. So my question I'm posting, asking fellow health worker is how I see concerned health worker, how can we as a work together, collaborate and network, call upon to be able to call upon governmental authority, and also to call upon goodwill people to be able to help to prevent malaria. Because malaria is killing people, is a leading death of it's a public health concern, and it's a leading death in our community. We have to work together to prevent malaria because it will prevent malaria, it will be saving the life of the babies, it will be saving the life of the pregnant women, it will be saving the life of our people in the community. So I am very, very grateful that I was invited as a guest of honor to be able to share with you the prevailing conditions that we are passing through as a people and as a nation and as a global community. That we will be able to work together to ensure that we prevent malaria globally. Thank you so much.
Thank you very much indeed. Our first speakers again. Today's event is about you, health workers facing malaria every day. We're going to hear from one more person. I'm calling on Josephine. Josephine Desda V. Josephine, si vous êtes là. Josephine, are you able to speak to us? Calling on Josephine Zedave.
Hello, everyone. My name is Josephine. I come from the Republic of Congo, and I am the founder of a female organization. We work on the prevention of malaria at local level with awareness raising campaigns and communication and information campaigns in the communities. And I would like to know what initiatives are organized by Teach to Reach. What are the financing opportunities for the small local organizations in future?
Parfait, merci. Alors, we're now going to welcome and acknowledge and salute our partner who's made this event possible. New Teach to Reach partners for Teach to Reach 11 that just happened last week. And we want to warmly welcome to the Teach to Reach family through this special event, RBM Partnership to End Malaria. Charlotte, over to you to read this excerpt from the message from the announcement of this partnership between the Geneva Learning Foundation and RBM Partnership to End Malaria.
End malaria, we have to empower the people closest to the problem, health workers in affected communities. This partnership with the Geneva Learning Foundation allows us to listen to and learn from those on the front lines of malaria control, ensuring that their voices drive our global strategies and actions towards elimination.
Thank you, Charlotte. We thank and acknowledge RBM Partnership to End Malaria. They're with us and we're really with you to listen and to learn. Everyone who registered for these for this special event has already received our first collection of insights, shared experiences shared during Teach to Reach 10. We'll be sharing following Teach to Reach 11. We'll be sharing a new set of insights with you. Now, we want this today is about your stories. It's about your experiences. And I'm going to ask Charlotte to share a first quote that we really selected ahead of this event from Dr. M. Athanase Som, who's a public health specialist in Kroon District, the Ministry of Health of Burkina Faso.
Malaria can make you lose lots of money. This year in my family, 4 persons out of 6 experienced malaria during the rainy season. During 3 days for me, there was no possibility to work.
Dr. Jean-Olivier Raphael, working for the Ministry of Health in the Ivory Coast. Malaria is a difficult infection in our country. At the beginning of 2024, my daughter was hospitalized due to malaria, and I'm far from my family due to my job.
Gwendolyn, a community health agent supervisor from Nkobisen Health District, works for the NGO in Cameroon.
Due to the negligence of my family that is living in a mosquito-dominant zone, taking auto medication immediately, we had fever and headache, we ended up having serious malaria cases. My family lived in a neighborhood with a main street gutter that is always having stagnant water.
Thank you, Charlotte. Now, before we go any further, what we're going to do is something very special and very important at the Geneva Learning Foundation. If we ask you questions, if we ask you to share your experience, it is in order to give it back to you and also to honor and recognize those of you who shared. So before we go any further, having heard the first few experiences shared, the first few introductions, and having really welcomed our new partner, RBM Partnership to End Malaria, to this special event and to the Teach to Reach family, we're now going to share with you the full list of names of all of the health professionals who contributed ahead of this event. Today we'll only be able to hear a few of you, but we recognize and honor all of you. Here we go. So these, you see the list of names. We've kept the English and the French separate. Actually, we brought the English and the French together, and we're really We hope that you'll see your name. It's not too late to contribute. If you do not see your name, it's in alphabetical order by first name. You'll see many, over 70 countries represented. Each and every name on this list is a health professional who took the time to share their experiences with fellow health workers, but also with global partners like RBM Partnership to End Malaria listening in. Some of you did. We ask you, of course, for permission to share your name. So some of you may be anonymous, and for whatever reason, that is, of course, entirely legitimate. We appreciate each and every contributor that is making this special event possible, and also sharing the experiences that you have of what actually works, how to make it work in the fight against malaria. Whatever your situation may be, whichever country you may be from, we're pleased that you're here and honor and recognize your contribution. No matter who you are, no matter your job role, no matter where you are, where you work, you're in a position to make a difference. If you see your name more than once, it is because you answered more than one of the Teach to Reach questions we asked you ahead of the event. And these are all of the contributors since Teach to Reach 10 that we're acknowledging and honoring today. More than 750 contributions ahead of this special event on malaria, sharing frontline experiences. Whatever level of the health system you work at, you took the time to share an experience, an insight, something very tangible that we'll be hearing today once we've gone through this very important moment of honoring and recognizing each and every person who contributed ahead of this special event. There you go, from A to Z, your stories, and every participant in the special event has already received, but we'll be sharing more widely the eyewitness report published together with RBM Partnership to End Malaria. For those who do not know, maybe wondering, what is this Teach to Reach? What is it about? It's peer learning for health professionals, and it's really, we've seen amazing, remarkable growth in the last 4 years since the very first Teach to Reach. The last Teach to Reach event in June had 21,398 health workers participating, almost 2,000 contributors. Teach to Reach is really a step-by-step process. There is a before, during, and after Teach to Reach, and that is also what makes it possible for us to come together for these events. Before Teach to Reach, we ask you, in fact, to answer questions. And through these questions, we build the portfolio of experiences that the community can benefit from. And ahead of this specific malaria event, we ask you specific questions, of course, about malaria, starting with how malaria has impacted your life, your community, and your family. We gave you, this was just the very first of a whole set of questions that we shared with you. And this is the question that we're going to start with today. if we'd like to ask you to, so we are going to lower all the hands now and ask you this question. If you are one of our guests of honor, please, and you are ready to answer this particular question, please, this is the time to raise your hand. Over to you, Charlotte, to guide us for our first speaker to answer this question. And please, if you are speaking, don't forget to introduce yourself.
Yes, Reda. So we already have Amadou Gay, whose mic is unmuted.
Okay. Bonjour. Je vais parler le français.
Hello, everyone. I will be speaking French because it is easier for me. And I'm the president of the Coordination Center against tropical diseases and malaria. I come from Guinea Republic. Welcome. It's a pleasure to meet you. Please go ahead. Thank you very much. Well, to answer your question, I remember something which happened long ago. A friend of mine was affected by malaria during internship, and we were 8 kilometers far from the city. This caused some issues, some problems. How can I explain this? Well, he started to have some crisis due to his health condition. And we were in a Catholic environment, so people thought that he was possessed, and that caused even worse issues. But at the end, he started to have so serious crisis, and his body was like stuck and rigid. So he was transferred to a health center, and he had an issue with anemia. He was diagnosed with serious malaria. Since then, well, actually, previously we didn't use any mosquito nets, but since then the doctor recommended to use nets. So this is the history I wanted to tell you, the story I wanted to tell you. Thank you very much. Charlotte, who will talk next?
I'm inviting Soles Jewel Morgan. We heard you earlier on. Are you able to unmute yourself? If not, I will turn to Mahesh Bhatt.
Yep.
Hello. Yeah, good morning.
Hold on a moment. We'll listen to Soles first, and then we'll come back to you for gender
you.
balance. So
Sure.
Soles, over to you.
Yeah, good morning. I'm Solis de Morgan from I'm a disease control officer. Yes, malaria has been a challenging issue, and personally, myself and my family have gone through infection from malaria. So my first son, who is 7 years old now, because we sleep under net, all right, but most of the times they sit in the hall for a very long time before they go to sleep. So in the course of it, he had malaria, and it was a blow on us. It was a severe one. We were hospitalized. We had anemia. We went through a lot, but by the grace of God, we overcame it. And because of that, myself have been a person, though I'm a health worker, but still talk about sleeping under net and going through all the preventive methods. Because my second son has never had malaria. It's almost 5 years now. And every preventive method that they fall under, I make sure we go through it. So we use ourselves as an example because of what we have been through earlier. Thank you very much.
Thank you very much indeed. And Celeste Jewel Morgan, can I ask you, what experience did you share? I believe it may have been related to an extreme weather event, a flood. Can you tell us more about that and what happened with malaria in the experience that you shared ahead of Teach to Reach 11?
So ahead of Teach to Reach, we talked about the global impact, and I shared about floods in my area. We found ourselves in between two big rivers, the Black and the White Volta. And during the rainy season, the farms flooded, and most people are moved because of the flood from their homes. And you get people sleeping in classrooms, people cottages, wherever they get themselves to sleep. There are sometimes they are fortunate to get tent. And because of these issues, they are predisposed to mosquito, get malaria. As health workers, we try our best to intervene. We have to send them mosquito net because people rooms have been flooded and they can't even find their net. So we step in to do our best so that these people do not come, because at this instance they don't get better food to eat, they don't get better place to sleep, they become anemic, in all sorts of conditions. So we step in to do our best to help these people. Thank you.
Thank you very much indeed. Now we have way too many messages to be sharing. Let me see. I think Charlotte, have you already got our next speaker lined up? I am going to introduce. I wanted to say that, as you know, Teach to Reach began with the immunization community, so we know that in the studio with us there are many immunization staff who are in fact involved in their country's malaria vaccine introduction. So if that is a topic where you shared an experience for this ahead of this special event, we do want to hear from you as well. Back to you, Charlotte, to guide us to our next speaker.
We have Naemeka Sibeidu. I'm asking you to unmute.
And I think from Nigeria, we have Imam Wada Bello, who shared in the chat, which is what we ideally. Please share a quick summary of what you're. Yep. And Naemeka Sibedu, over to you.
Yes, sir. I can hear you. So I would want to know what the question is, please.
Yeah, so first of all, if you can tell us about a time when severe malaria affected someone close to you, but then we also want to know what experience or experiences, plural, you shared ahead of this special event with malaria or with other related topics.
Okay,
and do introduce yourself first.
I'm Dr. Sibudu. Yes, thank you, sir. Thank you, sir. Thank you, Charlotte. Now, I'm Dr. Sibudu Nemeko. I'm actually a community health physician. I'm the chief resident in the Department of Community Medicine. I work in a local government. I work in a teaching hospital, but my outstation is actually in a local government. So I'm more into the community. I've had the opportunity to manage patients, and I do that on a daily basis, even as we speak. So I have had a close call with severe malaria. Funny enough, it was a staff's child. What really transpired was that, most times individuals actually, without doing the normal investigations to exclude other things that could cause malaria and fever, go ahead and start treating. So in this case, the mother had actually used an IV medication, an intramuscular medication that's Ataeta, without actually finding out this was severe malaria. The child came in and was almost out of our reach. When I mean almost, the child was pale, anemic. The child was breathing quite fast. When we looked at the child, she was quite lethargic, and more importantly, this spike, the fever spike. And it was really something that made us panic. All we had to do was go back to the drawing board, gold standard for diagnosis of malaria, MRDT, WHO, then microscopy actually is what most people prefer. So when we did that, we found out that the pathophysia was rather much Rather than using what she had already started on, which is IM Arteta, we went for what is advocated, which is using the intravenous artesunate. What it did after the first dose was bring this child almost back to normal. And we took care of the other things, anemia and the rest. So it was a close call. What really was instructive for me was that even healthcare workers are not spared. So we need to do what we should do. We need to apply the regulations and the guidelines. Then we also need to encourage people to use the proper medication. So I've also had the opportunity of joining the Geneva Learning Foundation with regards to immunization challenges. I happen to be the adverse effects officer in my local government. Thank you very much. Thank you, sir.
Thank you very much indeed. Now we're going to go over the different questions that we'll be asking you in the second half of this event. This really was to highlight the extent to which, as health professionals, you yourselves are affected by malaria. We have many other questions. Next is on your country's malaria vaccine introduction, if your country has already introduced this vaccine. We also asked you ahead of the special event of a particular moment when you could not get malaria vaccines or tests when you needed them. So if you'd like to come in on any of these questions, please do raise your hand. We've already activated the microphones, in particular of women participants and our guests of honor, but we do look to your messages in the chat and to your hands raised for Charlotte to select our next speakers. What do you do in your work to ensure that pregnant women do not get malaria? So really prevention of malaria for pregnant women is the next. And for those of you who are saying hello, we'll first work through the questions so everyone in our studio can understand what questions are being asked and can choose which one you'd like to answer. Tell us about a time when your community came together to fight malaria in a way that really worked. If you have a story like that, we'd love for you to share it today. And if you can tell us also if you saw a specific moment when you noticed changes in the weather over time were affecting malaria in your area, perhaps related to climate change, we would love to hear from you about that. And last but not least, looking forward, and we'll emphasize this question towards the end of the event. What gives you hope in the fight against malaria? Charlotte, I see we already have many participants ready to speak. Starting with Mireille.
Hello. My name is Marie Kima. I'm a vaccinologist. I've just ended my education in Senegal. I'm happy to share the experience I had with all of you. Since last November, vaccination has been introduced in our community, so we can vaccinate children, and 10 promises have been made, including the promise to vaccinate children. So we've made a great step ahead. And in fact, this is crucial because malaria causes a high death rate. We have a very specific question to ask you. Can you remember a specific moment? Did you have any situation in which anyone was a bit worried about vaccination and you were able to convince people? So what have you been doing in order to be able to introduce vaccination? Thank you very much for this question. Well, in fact, we've been able to intervene in the provinces to make communication work properly, to inform people about prevention and importance of prevention. And we first addressed the political authorities with advocate activities, and the political authorities actually accepted our campaign and decided to accompany us in the introduction of vaccination against malaria. That's very important. And we had an agreement in Addis Ababa for vaccination. The authorities were required to introduce vaccination in their political programs. That was very important for us. And we informed all healthcare professionals because it's important for everyone to be aware of the available situations. The community saw the importance of vaccination. So we've decided to move on with the introduction of communication campaigns in the communities and with the authorities. And now we are spreading vaccination in other areas, including other provinces. Thank you very much, Mireille and Kima. And remember that we have spread a lot of questions. So depending on your experience, please make sure that you answer the relevant questions. If you haven't been able to contribute earlier and you're not guest speakers, do not hesitate to raise your hand. And now Charlotte will give the floor to the next.
We have Abena Esther. Abena Esther Giama, your mic is unmuted. Over to you, please.
Okay, thank you. Good afternoon, good morning to everyone. I'm Esther from Ghana, a health promotion officer. So I would want to talk about pregnant women and how to prevent malaria. So in one of our occasions, we met a woman who was in her first trimester, and upon several conversations with her, we realized that she didn't like to use her mosquito net because she felt it is warmer sleeping under the net. Yet this woman has been on admission twice for malaria. So we spoke to her and then made her know the importance of sleeping under mosquito nets and the implications of her getting continuous malaria, that it can affect her child and herself. She can even lose her life. So she realized that at her age, she needed child also. So in that case, she must do what is right. And so she promised that she was going to sleep under the net, of which she helped in doing that. She started her antenatal clinic. She also started using the mosquito net. And then she also, at the 16 weeks also, she also started taking her SP, which helped her so much that she was able to pass through the various trimesters. So she delivered safely. I was much happy because hadn't been some time ago.
Oh, and Charlotte, I've just lost Esther. Yep.
Oh yeah, same with me.
Let's see if she comes back. Oh, that's
So I
so
wouldn't have
unfortunate.
enough time for her.
Here we
That
go.
I
She's
heard from other health workers.
One thing I heard at the end was that the woman delivered her baby safely, but we want to know maybe how they got to that point. So Esther, if you can add that in the chat. So we had Ruden that type in the chat, writing Louise Caru. Your mic is unmuted.
Oh, thank you very much. My name is Lois Karue. I'm a registered nurse in Boso Côte d'Ivoire. Hello, are you able to hear me?
Yes, please go ahead.
Oh, my name is Lois Karue. a nurse working in Kenya. I coordinate malaria services in the sub-county where I work. And I wanted to share my experience on a pregnant woman who got malaria and what happened that I'll never forget. So some time back, are you able to hear me?
Yes, loud and
Yes.
clear.
Okay. Sometime back, I came across a woman who was married to the husband was living where we work, but her rural home is where malaria is an endemic, is a pandemic. It's vast. So when they have fights at home, she would actually run away from their matrimonial home and she would go back to her rural home. So the challenge was when she comes back, she does not know maybe she's contracted malaria. And every time she would present in hospital with complaints of fever, chills, and the healthcare workers, because where we are staying, the county where we are staying, the prevalence of malaria is less than 1%. So it's likely the healthcare workers, the index of suspicion was not, they wouldn't suspect malaria at first glance. So we would treat her for other diseases like maybe pneumonia because no one was keen enough to initially to check if this client maybe could be suffering from malaria. So it went on and on until maybe until the second trimester. And this woman, she started presenting with the chills and everything. And it's all by good luck. The clinician who was seeing her that time is when they tried at least to get history from this mother. What really happened? She lost her first pregnancy and under unclear circumstances. So this was her second pregnancy. So thanks to that clinician, we had actually mentored the healthcare workers. When a client comes, first of all, we don't treat malaria presumptively. We do the testing through MRTs, and if it's we have high suspicion of malaria, we send for microscopy. So that was done, and actually, surprisingly, the test turned positive. So when we tried to talk to the client, she was a bit hesitant. For her, she says malaria is common and she doesn't feel like she has any symptoms. But what she's presenting with was this fever, chills. Sometimes her HB had gone down, and she was a bit hesitant to get treated for malaria. But with counseling, she agreed, and it was a learning point for even the healthcare workers because where we are staying, where we work, we are currently working on eliminating malaria. So it was a learning point for the healthcare workers. We insisted that every time a client comes and we are suspecting malaria because the client maybe has had history of travel to a place that malaria is endemic, we should always do the test, either using the MRDT or sending it for microscopy. And those tests are usually free for pregnant. So actually, yeah, it was a good experience, a learning point for all of us. And yeah, I'm proud to share that experience with you. Thank you.
All right, Charlotte. Thank you. That was, and I see there are many really people sharing, health professionals sharing really powerful and compelling stories in our Zoom studio. I'm so sorry we won't be able to get to them all, but we are trying, and we have a few minutes left in this special event. So please, we hope that this will be the first of a series of engagements working with RBM, the Partnership to End Malaria. Looking back to Charlotte, there are many moving stories. I spotted one in particular from, let me see if I can, yes, from Sadia Ramatu Hassan about the way mosquitoes are adapting with climate change. But there are many other stories. Charlotte, over to you to tell us who we shall hear from next.
Already, I would like to turn towards Abdul Musa, who left a comment in the chat. And afterwards, we'll listen to Dominique Bilumu, who has had hand raised for long and also left a comment in the chat. So, Abdul Musa, over to you.
D'accord, merci. Bonjour.
Let me introduce myself. I've had the chance to take part to the African Leadership Program for the management of malaria. And this is a specific program. I would like to share my experience concerning elimination of malaria. I've prepared a presentation to share just to show you what is happening in our country. This is a great challenge we have. Malaria is endemic, so it's important to take action in a very targeted way. And in the health communities, many people do not believe in the elimination of eradication of malaria. So I think it's important to have proper communication. We need to understand what we expect when it comes to eradication of malaria. So this is what I wanted to share. And I also have some other experiences to share. If I have the time, I can also explain that I took the opportunity to take part to training on malaria. And thanks to our activity, we've been able to take charge of the many cases that affect us. In my experience as a clinician, people think that malaria is something trivial. In fact, malaria is a big issue. It's important to intervene in terms of physiopathologies. There's still a lot to do in terms of communication in order to raise awareness to prevent the disease. Thank you very much for your attention. Thank you very much. And now we continue with Dominic. We would like to give the floor to some people, some women. So Dominic, can I give you the floor? Can you take the floor? Otherwise, I will. Hello, good morning. Thank you very much for giving me the floor. My name is Mayemba Naomi. I come from Kinshasa. I'm very happy to take part to this event to share my experience with malaria. I have a personal experience myself. It was in January 2023. 2023 started with this disease, and I had malaria myself. I had fever. Unfortunately, the first symptom only included fever. Then I took anti-malarian drugs, but this didn't work. I had a strong resistance, and then my condition got more serious. It was the first time I had such an experience. It was really very hard, and it was very difficult for me even to talk. People were not able to understand it was really very serious. It was the first time I had such an experience. But after malaria treatment, the fever disappeared and I progressively improved and recovered. But for a few weeks, I still had some disbalance and I had difficulties at moving, walking just a few meters or standing. It was really an experience I had never had before. I understood that malaria is not as easy as we consider it to be. Sometimes it's considered to be something trivial, but it isn't. It is not a benign condition. It's really very serious and it's a key issue with public health. It is true that sometimes the symptoms of malaria are quite simple, but as the disease evolves and develops, we understand it is very serious and this requires an intensification of the treatment. So this is what I wanted to share. That's my personal experience. And in our country, we've noticed that using mosquito nets alone is not enough. Mosquitoes nets are just one option. They are just used when we go to bed, but we should use mosquito nets the whole day. So we spend the whole day without using mosquitoes nets. So mosquitoes are there, they can attack us during the whole day. They are already present around 3 p.m., 4 p.m. So mosquitoes nets are not enough if they're just used to go to bed at night. And in addition to that, mosquitoes are becoming more and more resistant. They're also resistant to sprays. So they are reactivated after a few minutes. So it's really very difficult for us. So I think that we really need to work together and collaborate deeply in order to eradicate paludism and malaria. Only by working together will we be able to achieve results. And positive results are required, of course.
D'agir avec vous aussi.
Charlotte, it's hard to believe, but we've been here for already a full hour. We've heard just a few voices. We want to honor and recognize every one of our guests of honor. We realize, of course, we did not expect this many participants to attend and for this much sharing to happen so quickly. So we really want to appreciate each and every one of our guests of honor who shared an experience in relation to malaria before the event. We are going to extend by 13, 14 minutes in line with our interpreters' requirements. And then we really appreciate all of the great sharing that is going on across the language barrier in English and in French. We have many more, much more sharing to do. Charlotte, over to you. I wondered if we could hear Sadia in particular had shared about the changes in weather leading to changes in patterns in mosquitoes. Perhaps Sadia Ramatu Hassan, we could hear from you. That, of course, is likely to be related to change in climate as well. Sadia, are you able to speak to us? Asking you to unmute, but not responding so far. So back to you, Charlotte, for our next speaker.
Yeah, we can hear you. Thank you very much. My name is Rosemont Changa. I come from the Democratic Republic of Congo. I would like to share my experience as well. Some years ago, I was in Congo in my community, and I met a cousin of mine. She was really ill, and she had been affected by malaria. She'd been suffering for a couple of weeks, but the community didn't consider that. For a lot of days, she was just treated by charlatans. When I arrived, so she had fever. I started to raise awareness in the community. And I explained that it was important to go to hospital. It was really difficult for me to be accepted because she was supposed to get married soon, and her mother-in-law didn't want, but I continued to insist. I talked to the old people of the community, and at the end of they were able to be convinced. She went to hospital. She was pregnant. Unfortunately, she lost her baby, but she was rescued. So since then, I've decided it was important to raise awareness, and I understood something very important with that experience. Our beliefs prevent us from understanding that malaria is the main cause of death in our country, especially when it comes to pregnant women and children under the age of 5. So mortality in this group of people is very high due to malaria especially. So raising awareness in the community is crucial. So it's difficult to make people understand that when the first symptoms appear, it's important to go to hospital. And then poverty is also worsening the situation. So even people who go to hospital to receive a diagnosis, well, they cannot reach hospital in time. So people see go to hospital very late, and before going to hospital, they do self-medication in case they are ill, they have fever, they go to the chemist, and that's it. They buy medicine, they go to hospital very late. In order to fight against poverty, communities must be equipped with the resources necessary to take care of this. Malaria among pregnant women and children under 5 should be treated without any cost. If we could do that, if we could help women and treat them without any cost for them, of course, death rate would go down. Climate change in our country is the cause of flooding and erosions, and people who live in the areas that are subject to erosion, well, they are affected by malaria. And weather conditions cause the multiplication of mosquitoes. In the communities, sometimes mosquito nets are distributed, but not everyone uses them. So we've collected and we've noticed all of this. So I think it's important to start advocacy with the ministries and the authorities to make sure that malaria is treated free of charge in all centers, and especially when it comes to pregnant women and young children. I would like to share another experience. I met a lot of people in the western area of my country, and I've noticed that in their communities, a lot of people have been affected by malaria, but they didn't even know, and they are often treated very late. So there are people that leave the country, spend a lot of days in the forest, and this is the ideal environment for mosquitoes to proliferate. So they are attacked every day. And in those conditions, people are often very weak already. They're often suffering already from malaria, but no one knows. So when they reach hospital, they are already in very serious conditions. So we need to have advocacy activities in order to make sure that cases of malaria are recognized immediately. And when people spend a lot of time in forests, we need to make sure that they are really treated. That's my contribution. This is what I wanted to share with you. Thank you very much.
Be assured that of two things. One is that every contributor, every guest of honor will be honored and recognized in the second collection of insights we'll be publishing following this special event. And two, we hope that by working through RBM Partnership to end malaria, this is only the first of a series of events, activities that will be working with the malaria community to really bring the power, the lens of peer learning, the experiences that you have to bear on the problems and challenges that you face. So Charlotte, back to you for the difficult choices of our last and maybe next to last speaker.
Yes, Reda. So we have Christopher Amalu, whose mic is unmuted. Go ahead, Christopher, and do start by introducing yourself.
Thank you very much, Charlotte, and thank you, Redia, for this opportunity once again. I thank all the participants. My name is Christopher Amalo. I'm the Program Director of Royal Healthcare Foundation, a public health parasitologist in Nigeria. Well, I want to dwell my experience on the last teach to reach, where I obviously mentioned my observation in terms of the mosquito, the vector of malaria, in changes in behavioral patterns. And these changes has actually, been observed over time, that the usual early morning biting and evening has actually changed. That mosquitoes, you find them biting late morning hours up to 11 a.m. and that's why indoors. But outdoors, you can also find them even all daytime, especially in the poorly illuminated rooms. The implication is that unsuspecting household members, especially children and women carrying, are at high risk because they lose their guards and no personal protection at that moment. While the male counterparts are usually at their workstation during this period. So this obviously is implicated to changes in climate change and call for research scientists, especially in this southeast region, to understudy the behavioral changes in the behavioral pattern of these female Anopheles mosquitoes. So that way we can actually advise people more when we do our community outreaches.
Yeah, so I'm inviting James Tokba or Tijani Suleiman, the first to unmute.
Okay. Good evening to you. I'm Tijani Suleiman from Zamfara State, Nigeria, a public health specialist, an advocate to end malaria, a better nutrition, and zero dose. So what I have to share in quick is that as a head of one particular general hospital in my community, I serve as a head of a general hospital. There's one instance that I noticed remarkable change in the malaria that called my attention seriously. That was 2021/2022, where I see during the rainy season, where I see there is sharp increase in the malaria cases that compared to the previous uh, month. So what make me realize that there is a change, and that change affect mostly the pregnant women and the children, is that we learned that during in the report we have there's mass increase in the case report one, and also that mass increase in the case report called my attention as a head that there is really a serious issue that affects our community in regard to the malaria. And also the extended rainy seasons. The rainy season has extended beyond the month that we expected to stop. So that called my attention to take an actions as the head of the particular institutions in collaboration with the RBM and the disease and notification officer with the support from the Ministry of Health. So we make what we call community-based sensitizations, and also we start with the community and community engagement, and also we distribute ITNs and Indo residual spraying so that to see all those cases of malaria that come rampant in that particular stations has been reduced. And also we did what we call environmental management. In that environmental management, we engage the community and the environmental officers for the sanitation exercise to clear gutters, fill photo holes, and eliminate other mosquito breeding sites. That helps us to start seeing the reduce in the higher level of malaria cases in my community. So this is part of the experience I learned, which really caught my attention because especially the pregnant woman suffered a lot. But with the other measures that we take, it reduced promptly. Compared to this 2023/2024 sessions, we see a remarkable change in the cases of malaria in that my particular area. So I have a lot to say, but due to the time factor, I may able to stop here so that you may ask me questions in regard to that. Thank you very much. I really appreciate it.
Thank you very much indeed. We hope this is the beginning of a global conversation around malaria in collaboration with our partner RBM Partnership to End Malaria that made today's event possible. We wish to thank them for creating this space, helping us create this space for the voices and experiences of health workers. Once again, thank you. And we have one last thing to ask, if you can share this event, if you enjoyed this event, to share with your colleagues. Si vous avez apprécié cet événement, n'hésitez pas à le partager avec vos collègues, c'est très très important. Merci. Thank you for this amazing event. We hope this is only the commencement, the beginning of health workers connecting, learning from each other in order to do better to end malaria. We're now going to cycle back through all the messages. And so this is your last chance to say goodbye. In the messages, we'll try to share as many of them as we can before we close the session. Here we go. All right, we'll keep the studio open as there are more messages coming in.